Dr. Georges Benjamin is with me, MD. He is known as one of the nation's most influential physician leaders, and he was the Secretary of the Maryland Department of Health and Mental Hygiene, oversaw the expansion and improvement of that state's Medicaid program. He's a board-certified in internal medicine, fellow of the American College of Physicians, fellow of the National Academy of Public Administration, a fellow emeritus of the American College of Emergency Physicians, and an honorary fellow of the Royal Society of Public Health. His recent book, The Quest for Health Reform, A Satirical History, is an expose of the nearly 100-year quest to ensure quality, affordable health coverage through the use of political cartoons. How cool is that?
It is cool.
It is, yeah. It is a member of the Institute of Medicine and National Academies, and on it goes. Dr. Benjamin, it's a pleasure and an honor to have you with us.
Tom, thank you very much for having me.
So what are the issues before us right now?
Well, at the end of the day, the issue is whether or not we're going to continue to allow this health insurance premiums to be affordable for people that are buying them through the exchanges. And that's the real challenge. The whole purpose of doing health reform in the first place was to make sure that health insurance was affordable.
We should add, normally you have a resonant voice.
God, yeah.
You got a bit of a cold right now?
My voice is... Yeah, I've lost it today.
Yeah, that's remarkable. It's not often that I hear a voice that far gone. You must have been out there yelling at the Supreme Court all day yesterday.
Well, I'll be yelling all day tomorrow. That's for sure.
Yeah. So what's going on tomorrow?
Well, tomorrow is when they have their oral arguments.
Yeah, and King v. Burwell. Yeah.
And King v. Burwell, and as you know, they're going to be debating whether or not health insurance premiums, assistance. Should occur in those exchanges that were established by the federal government.
Right.
And they're debating a very nuanced point of law, which most of us believe is something that should never gotten to court. Yeah. But here we are.
Yeah. Well, and I would say that the reason it got to court is because this court has abandoned traditional jurisprudence and become a political entity. They are behaving like political animals. It's crazy. I mean, there really is no basis for this lawsuit, and the idea that 13 million people could lose health insurance, health care, that another 8 or 9, 10,000, depending on whose numbers you're using, people could die in the next year if the Supreme Court. I mean, I'm just astonished. That they would even take this case.
Yeah, well, they're arguing the law and not the health impact.
Right.
But they need to consider the health impact.
Yeah. This court, they remind me of the, I forget the name of the court, but the court that ruled that child labor laws were a violation of the right to contract, back in 1913. The Lochner Court. Yeah, thank you, Shana. It's just astonishing. So, Dr. Georges C. Benjamin is with us, and actually, where did my one sheet go? Here we go. APHA.org, by the way, is the website for. Is that the American Public Health System?
American Public Health Association.
Tell us about the American Public Health Association.
We're a professional society of people interested and practitioners of public health. We're the oldest in the world. We've been around since 1872.
Wow.
Yeah. So we are really the history of public health in the United States, and we've been supporting universal health care for all Americans in terms of health insurance coverage for over 100 years.
So you wrote the book on the history of the effort to provide health care to all Americans. What does that history look like? What were the milestones? Were there any unexpected? I believe Teddy Roosevelt suggested a national health care system. I don't know about other presidents.
Well, it goes back to the 30s, and certainly Teddy Roosevelt was very much one of the forefathers of that effort. What's important to know is that we've heard these arguments against universal coverage since the 1930s.
Yeah.
We said that, boy, if we start covering people, the world's going to come to the end and people will die. And we've heard that regardless of political administration, there's been health reform. And the truth of the matter is, we've continued to cover people. We've continued to find innovative ways to get health insurance coverage for everybody. We're not quite there yet, but I can tell you that the world hasn't come to an end.
Right.
And doctors still have the autonomy to take care of their patients, and the economy is continuing to grow.
Yeah. So, 4 years ago, we were hearing from Republicans that if the Affordable Care Act, Obamacare, became law, that we would see hospitals crashing, we would see doctor practices going out of business, we would see, people having to wait, years to have, that gangrenous foot removed or whatever. I mean, it was just all these horror stories. What has been the consequence of the Affordable Care Act so far?
In the places that have not expanded the Medicaid program, for example, hospitals have begun to close.
Yeah.
But places that where the Affordable Care Act has been put in place and acknowledged in a robust manner, those hospitals are doing fine. Those doctor practices are doing fine, and those patients are doing fine.
Yeah, we had the mayor of, I think it was Burwell or Bellflower, North Carolina on the program. He was a Republican, the mayor of his small rural town. They have a hospital. It's closing down. And he marched from North Carolina, this Republican mayor, marched from North Carolina to Washington, D.C., asking for North Carolina to expand Medicaid so that they could get their hospital back. It's incredible. I mean,
they did, and they came up with some really weak, the community pushed to get their hospital back, and they've really not solved their problem.
Yeah, well, they've got their own local Koch brothers version, and Art Pope, this billionaire who's kind of runs the state these days in North Carolina. It's very, very bizarre. Dr. Georges Benjamin, anything that our listeners need to know about right now? Anything that they need to be doing in response to this, or is this a matter of just hang on to your hats, let's see what happens?
Well, I think they ought to educate themselves, but I would encourage people to call their elected officials and tell them, listen, say, I support the Affordable Care Act. Write letters to the editor. Get the media engaged. Make sure the public is well aware of the consequences of what might happen. And then should the court rule against the administration, they will be poised to be part of a grassroots movement to get the Congress to do whatever legislative action they need to do to make it right.
Yeah, and in my opinion, that legislative action is to drop the eligibility age for Medicare down to 0. What do you think?
Oh, you mean like Medicare for all?
Yeah.
You mean a rational?
Yeah, it was a radical idea that every other developed country in the world pretty much has done.
One that works.
Yeah. It's cheaper than what we've got. It's more effective than what we've got. It's simpler than what we've got. Yeah. You would think that, that would be kind of a conservative idea, actually.
Well, we have a conservative idea. It's called the Affordable Care Act. There's lots of conservative ideas in it. Yeah. And I can tell you that if it goes, I can assure you that people that support Medicare for all will be pushing very hard for that to be our next stage of health reform.
Yeah, there you go. Dr. Georges Benjamin, it looks like you've got to be someplace else. So thank you so much for dropping by.
Thanks, Tom.
Pleasure meeting you.
Pleasure.
Thank you for being a guest on our program today.